So I hear that, you've had a few classes or lectures related to advocacy. Am I correct?
Yeah, that's correct.
Okay. Okay, so this is going to be a lot of conversation. So, there's going to be 2 breakout sessions. So I think let's have an informal conversation here, because advocacy is more of, and of course, outreach and leadership, it's more of like, strategies and actions that needs to be like talked about. So I think in the rest of the series for advocacy related lectures, you will learn more about how going to the, Capitol Hill, or working with legislatures and in advocating for policies and all that. But, the main focus of this lecture is how, as a dental care professional in the community, how you can do advocacy, outreach, and leadership, how you can use these skills to impact the health of the people in your immediate community, and what are some of those strategies that you need to understand to make that happen. That is the crux of this lecture, how you can impact at the local level. So, to begin with, this is the outline of my lecture. I will define what advocacy is, and what is a dentist's role in advocacy, especially local advocacy. There are different components by which you can effectively adopt advocacy and perform advocacy. Following that, I'll give you a local kind of a local advocacy related scenario. We will break out into 2 rooms. I'll give you 10 to 15 minutes. So based on the components of effective advocacy that I will teach you, I would want you to elaborate on the local advocacy and what strategies you will follow, or the components that you will follow to do advocacy. Following that, I will discuss community engagement. What is its importance? What does it actually mean? And then to what extent, as a clinical dentist or a dentist in a community, you would realistically be able to engage in the or participate in the community. There are some examples that I'll provide, and we will break out for another session. Following that, there will be a small section related to leadership, and we'll talk about key terminologies, and then we'll end up in the lecture. So advocacy means different things to different people, and this has stuck with me since almost like about 10 years. And I have utilized this definition to even create an oral health advocacy toolkit for dental schools and dental hygiene programs, so that dental students and pediatric residents like you get trained in advocacy. So here, this is based on a study that was conducted, a Delphi study that was conducted in 2005. And this definition and the core concepts that are listed in this definition is what is being used for accreditation standards for pediatric residency programs. So like your pediatric residents, and there are CODA standards for you to get trained in, and based on certain CODA standards, right? So likewise, pediatric residents do have their own accreditation standards. And so this perfectly fits into, in my view, even with the pediatric dentistry CODA advocacy related standards. So advocacy means, to speak up, to plead, or to champion for a cause, while applying, your professional expertise and leadership to support efforts, not only, at the individual level, but also patient or the family, including the community and legislative or policy levels, which result in improved quality of life for individuals, families, or communities. so right in front of you, there are like, three definitions, related to self-advocacy, individual advocacy, and systems advocacy. Can any of you give me some examples, what self-advocacy means, individual advocacy means, and systems advocacy mean?
So self-advocacy might be, let's say you had some learning disability and you went to advocate to your administration to get specific accommodations for your disability.
Perfect example. Yes.
I think for individual advocacy, it could be something similar to what we do as providers for our patients who might have a difficult time in getting an appointment for us to see them in the OR to provide full mouth dental rehabilitation under general anesthesia. Maybe some physicians might want to take longer than usual to have their patient be seen in an appropriate time, and we advocate on our patient's behalf to try to get things expedited so that way their needs can be met.
Absolutely. Yeah, perfect.
And I think for the systems advocacy, a good example would be basically what we're about to do when we go to Washington by advocating for patients with special healthcare needs and the pediatric population as a whole. Absolutely. By changing like policies, laws, and rules.
Right. Yeah. So the both individual advocacy and systems advocacy is advocating for someone else or a particular group of population who cannot speak for themselves, right? So all the three definitions are exactly spot on. Amazing. Yeah. So when we talk about advocacy and in the local community, it's very important for you, as a dental care professional to also be a local community advocate. The point is that, because you're part of a community and you become a resident living in the neighborhood, you have to be more concerned about, health and welfare of the community, because that is where, your patients come through, right? So that becomes, a core responsibility as a dental care professional as well, to become a local community advocate. Okay, just by looking at this picture, can someone explain what this actually means?
I guess
from any perspective, from any perspective, I'm not giving you any perspectives now, but just by looking at this, what comes to your mind?
Well, what comes to mind is something that I think our program really tries to instill in us as future providers, in that we will have our individual clinic in our community, and we will see issues that our patient population is dealing with. So we go and use different avenues to push forward certain initiatives that can be a benefit immediately to our community. So speaking to being a part of the local dental society, being involved in this local schools, working with daycare centers or working with other healthcare providers to try to influence as much as we can local policies or measures that can help our community. And then in a larger context, try to negotiate with insurance companies or be involved in state, national dental organizations to advocate for policies that would not only be a benefit to our community, but for communities at large.
Absolutely. I didn't even ask you, from one perspective, but I think you gave me, whatever perspectives that I was going to ask you, so yeah, phenomenal. I was also going to, ask all of you to have an advocacy lens, over, your vision, and then see how you view this. And is it Tariq, right? Tariq,
yes.
You touched upon so many points related to, leadership, community participation, and also advocacy. But I also want to hear from others from an advocacy perspective. Of course, you're part of the clinic, but there is immediate community here and larger community here. How do you think, from an advocacy lens perspective, you can view this figure or diagram?
Another way is that if you want to advocate for certain policies, and you can implement those policies on a smaller scale and show how effective they are, that can be kind of served as a springboard or as a demonstration when you go into a bigger field to say, hey, these were the policies that we wanted. We expected to get this sort of outcome. Here's the actual outcomes that we're getting. Here's the benefits of it. And here's how these situations, these issues that exist in other parts of the nation, how they can also be addressed, and our efforts can be used as an example to support what we're trying to accomplish for the certain policies that we want, and et cetera.
Yeah, absolutely. So I think you touched upon a lot of very important points. Does anyone have anything to add to it?
I was going to say, I think another thing, another way to look at this too, is that by advocating in the larger communities, we can have kind of downflow effects into our immediate community and then into our clinics. So we can also look at it kind of the reverse, not just from inside out, but from outside in, and seeing having that large scale impact move down into our clinic.
Perfect. Absolutely. So from my perspective, and because we're looking at the immediate community per se, and your argument of your justification of the larger community and trickling down is perfect example as well, Wes. When it comes to local advocacy, you being an advocate, what I would just a second. You're in the clinic here, but all these stakeholders, local government, coalitions, local dental societies, schools. So these are all your immediate stakeholders, and in one or the other way, you can use their expertise to advance a noble cause or principle that you believe in. For example, there are so many. I won't say there are so many, but there could be a healthcare coalition. If you go into a community and when you start advocating, yes, doing it individually is fine, but if you have a really good stakeholder like a coalition, like a healthcare coalition, you can actually work with them to further a cause. So that's the main point of it. Of course, you're part of the clinic, but you can't just work in silos. You have so many other people in the community and be interested in others causes, at the same time advocate for good causes, and there's going to be a larger impact, not only with your clinic, but also what you can contribute to the immediate community. So yeah, great thoughts. I would say until probably 15, 20 years back, advocacy was there in many of the mission statements of different organizations, but I would actually give it to AAPD. I think it is one of the organizations in the forefront that actually put a standard in a quota standard for training pediatric dentists in actually doing advocacy. And that becomes a very core responsibility of dental care professionals. Of course, there's ADA that is vehemently advocating for people to do advocacy, and also American Dental Hygiene Association that says it's dental hygiene is obligation to serve as advocate for patients' welfare. So what I mean, you may ask, we are all predominantly healthcare professionals, so why do we have to do advocacy? That's because you're actually positioned very uniquely to function as public health advocates. You understand about medical aspects, dental aspects, dental clinical aspects of a particular underserved population group than anyone else. You may be able to speak for, just as you said, an individual advocacy or a systemic advocate. Being a systemic advocate, you may be a better person to elaborate on these issues a particular marginalized group is undergoing. And believe it or not, public actually, of course, there is a handful of, or a particular proportion of, people who do not trust healthcare professionals, but majority of them, if you talk to them, they place a huge trust on healthcare professionals, and that is why, like, you can be public health advocates, and you're a credible source of information as well, and you being able to access local politicians and national leaders maybe a lot bit easier, rather than someone a normal average um, person being able to make a little move the needle. You may be able to move a little bit more sooner and faster on behalf of someone else who cannot do it by themselves. So these are all the reasons why you make ideal public health advocates. So advocacy is a set of different strategies and actions, and you use those actions to influence variety of audiences. So advocacy is just not trying to influence politicians, or not just politicians, but it can be county councillors, it can be school board members. You just use different strategies and actions. That's it. Like, you advocate for different causes, and your main audience could range from policymakers to school boards to local water utility boards. When you go for a water fluoridation hearing, like, you're mainly talking to a local county department, and those council members. So there are different ways by in which you can do advocacy, not just going to Capitol Hill and advocating for policies. You can work with the state dental societies and work with them on different regulations, for practicing dentistry. That can be easily an advocacy. So I'm actually giving you a link here. I don't know whether you got this presentation. I think Victor sent you this presentation. There is a link here which for a toolkit that I created 2 years ago. It has detailed information of what I'm going to present here. So just in case if you're more interested in advocacy, you can take a look at it. These are some of examples related to what advocacy actually mean, maybe in the local community. Participating in a community rally for maintaining community water fluoridation, calling a local TV station and encouraging them to cover better oral health issues, or speaking to school board to expand school-based dental programs. So these are all some small advocacy related strategies or causes that you can do. This is just a handful of examples that I'm giving. Does anyone have any questions so far? Okay, so I mean, advocacy is not, there is no hard and fast rule related to advocacy. You take a cause and you find ways to, promote that cause and try to bring in different factions together, meet with people, align your interests with others, and then try to make a change, right? So there is no, one way to do it. There are different ways that you can do it. So some of these 9 components that I'm going to talk to you, not all these 9 components need to be followed. Depending on the resources that you have, depending on the time that you have, depending on the cause that you're trying to advocate for, and the situation that you're in, the components of effective advocacy can change. You can probably be, maybe you can only do 3 or 4 components. Some may have enough resources and time to follow all these 9 components, which definitely will be more effective. But you can do whatever you can with at least 2 or 3 components that you think, that best fits your cause. One, creating a culture of advocacy even within the clinic. Of course, this is a non-clinical related culture that you have to force yourself into, maybe. But I think it's creating a pro-advocacy environment, within your clinic is very important. Maybe 15, 20 years back, community engagement, or going to school fairs, and I don't know how prevalent it was, during in maybe 20 years ago, but that has become going out to the community, doing engagement, school community fairs, making yourself visible in an environment, in a community. Those are all becoming a lot more important these days. That is a way you can create a culture of advocacy within the clinic. Maybe get involved in local causes, go to these community fairs, do outreach, give away brochures, educate people on during those events. These are all like perfect example of creating culture of advocacy within the clinic. In addition, you can address social determinants of health. Identifying patients based on certain social needs also is very important. This gives you an additional level of understanding of what patients' needs are, and by creating that culture, you would be able to achieve better patient outcomes with lower costs to the clinic. Of course, there are many advocacy issues, right? I mean, but you may want to pick one health issue. It doesn't have to be oral health issue. It can be any health issue that you think is plaguing that community, and that you think doing advocacy may impact that community. Coming up with smart which needs to be specific, what kind of program you're trying to change, or policy or a practice that you're trying to change. Can you measure the change that you're trying to make? But is it achievable? Is it realistic, first of all? And how relevant it is to your organization, and what is the time bound? Is timing clear? So I mean, these are all you will be busy practitioners. Yes, advocacy is important, but you also have to be smart about creating smart goals for one particular cause or multiple causes or issues that you want to advocate on. And this is a very important step. You are trying to advocate and present issues and make a change, and so you need to know who your audience is. Advocacy messages usually are directed to two kind of audiences. One are decision makers, and the second are influencers. Most of the times, if you're unable to go to the decision makers yourself, maybe you can use influencers as a first step to reach out to decision makers. Influencers are usually people who most likely may have better strategies, or they know better ways to convince decision makers. This could be social media influencers. Sometimes even parents and dental students, you and residents, may be better influencers as compared to someone who's well established. For example, one public figure that I could think of was a great influencer, Erin Brockovich, who actually can make a huge influence by reaching out to decision makers. And the next audience is the decision makers, who determine the law, regulation, rules, or other policies you're seeking to create. This could be local legislatures, state dental boards. If you're part of state dental societies, and if you think there are state dental practice acts or regulations that they create as not in the best interest of the dental professionals. You can always advocate to state dental boards or local dental societies. School boards are other example of decision makers. This I'm throwing a kind of an example. Consider you're in a hypothetical situation of a group of residents in a city called Pleasant Town. They want the city council to approve a plan creating a new park in the East End neighborhood. So if these residents identify the decision makers and influencers in their city, each group might look like this. So mainly, this is the ultimate decision. I mean, this is the ultimate target audience, who have the power to make the required changes of creating a new park in this neighborhood. But these are all could be like major influence that you can reach out to, because they are all involved in the community and ultimately will influence decision makers. At the same time, be benefited with having this new park. Athletic coaches, faith community, healthcare providers, director parks creation department. So all have some kind of stakeholdership, in creating this park. As I said, yes, doing advocacy by yourself, of course you can do it for sure. But if there are other allies, who share a similar vision, why not align with them? Why don't you collaborate with them? So seeking stakeholders whose interest that aligns with yours is very important. This could be anyone, like patient population, local churches, local community health organizations, even business owners, parents, teachers, healthcare providers, coalitions. And ask yourself, okay, you have picked up a cause and you want to advocate for it. Would this coalition or would this healthcare provider group, be interested in advocating for the cause that you believe in? Why would they care? So you need to understand, what their interests are, at the same time, creating this collaboration. So you have a cause now, you have, found influencers, you have found, coalitions. Now you have to create effective messages. Creating messages for policymakers and, local boards. This is actually not very simple. So, you have to follow, a strategy to create a language, that even a fifth grader could understand, because every audience has, different levels of health literacy. So one example that you could use is, CDC's Clear Communication Index, which will help you to create clear but very simple, effective messages. And core messages should follow, this 5 different elements. Are you identifying the problem? Is the problem evidence-based? So what do you want the audience to do? What action, the policymakers or the school boards, who are the target audiences, what kind of action do you want them to take? So what is the reality? Do you have the facts? And what is the solution? Identify what will change if action is taken. So framing messages also, very important. Messages stressing on impact on, for example, poor oral health is more effective than stressing the prevalence of oral health. So I give you like 2 examples. A less compelling message is, nearly 1 in 4 children has experienced tooth decay. I mean, yes, it's a fact. By the time they enter kindergarten, yes, it's stating a fact, right? But what happens if, they have dental caries? So that is what the next one gives you, which is more compelling. So which says children with poor oral health are nearly 3 times more likely to be absent from school. So you're not only saying there is dental caries of poor oral health, but because of that, the children are much more prone to be absent from school. So that is a better and an effective message if you're focusing on an audience like policymakers. Finding and presenting data is always going to be a little challenging because advocacy should always reflect evidence. But most of the times, local level data, there could be a little bit of local county health related data, but most of the times you should go to different national level data sets to get data from credible sources to create messages. With decision makers, it's always better to be simple, give them a brochure, a small infographic, even brief personal stories. Those are much more valuable rather than giving policymakers or decision makers a manuscript that is high, that shows like impact of dental caries could lead to death and stuff like that. You can always make it as a brochure and tell it in form of a personal story as compared to giving a decision maker even if it has been published in New England Journal Medicine, it may not be that effective, because it's the way that presenting data needs to be very simple to a decision maker. So you have messages now. How are you going to communicate that? What are different modes to communicate? Who should deliver these messages? Are you going to deliver? Is there someone else that can deliver? Will that person be better in delivering those messages? The best modes to communicate is you can through stakeholder meetings. If you're part of a coalition, you can send those messages through stakeholder meetings. You may have dental listservs. You can send certain messages through dental listservs, or there could be community listservs. I'm actually, or there are many social media sites. For example, I don't know how many of you do you know Nextdoor, something called Nextdoor. So it's basic. Yeah, I mean it's basically a community related, your immediate community related web. That tells you what is happening, what is not happening, what should be done in terms of community. It mainly gives you ideas as to basically the immediate community, what all is like good is happening, what has changed. So these could be a best way to send an advocacy message in a forum like that. Emails could be another best mode. So who else can be messengers? Of course, you are dental professionals, you're credible sources, but of course people will listen to you. But it would be it would also be equally important if oral health messages actually came from lay people, like from mothers, from parents, even other healthcare providers, because a decision maker would think, okay, why is this oral health related message coming from a physician? They probably may sit straight and listen it even more. So you can attack a particular issue, through different ways, and having multiple messengers, multiple people to talk about the same issue, might help. Establishing a media presence these days is very important. I see a lot of my colleagues, who do extremely well, with connecting people on media. 20 years ago, this may not be the case, But but these days, having a media presence is very important, because the normal consumer now goes to Google to find reviews on it, right? So you can utilize your web media, your website, to advocate for a particular cause. You can also build a relationship with media, with reporters and editors. Create a Twitter handle, Instagram, and you can improve the media presence of the clinic by advocating or tweeting for a particular important issue. And last but not the least, though I'm focusing on local advocacy, of course, this is important. Understanding, trying to advocate for policies at at the national level, is also important. So understanding decision-making process is also important, and not every process is in terms of legislatures or city council or even regulatory board or all the same. The process is different for each of these regulatory agencies. So understanding that is very important. If you're trying to advocate for a medical dental policy, then you need to understand how Medicaid operates, and how state legislatures actually makes those policies. Okay, now we have come to a section where I'm going to break you out into two groups. So this is the scenario. How do you think, as a private practice dentist, you could use some of these components? You saw 9 of those components to advocate for no sugary drinks in school vending machines. So how could a private practice dentist use some of these components to advocate for no sugary drinks in school vending machines? This should be very important for you, because there are many schools in the community that you practice. Of course, your children, your friends' children, everyone would go to the school. So how can you minimize this? Advocate for no sugary drinks, or even minimizing drinks in school, sugary drinks in school vending machines. With these 9 components, again, you don't have to use all the 9 components, but at least a few. You will be broken into 2 groups. So take some time. Maybe we'll get back around. How long do you need? 10 minutes?
Sounds good.